Hi everyone, this is Sue Doyle with OT Lifestyle Solutions, and this month is OT month, and so we're going to be interviewing some amazing OTs that are doing great things in our community. And today I want you to meet a colleague of mine, Carolyn Sithong, and I just thought we'd start with Carolyn. You're an OT. Tell me about how you got into OT and how long you've been an occupational therapist.
I've been an OT for over 20 years, and those years go by fast. But I love this question because it helps me remember my roots, kind of where I came from. When I was in high school, I had the privilege of volunteering at a hospital, and my job at the hospital was transporting patients to and from therapy because back in the day, patients would stay there for a long time and they'd get up and we'd wheel them to therapy and then they would be wheeled back. And that was what I did. And I remember there was an OT there who was working with the patient on his visual perception skills and teaching him how to read a clock and how he did like the clock drawing test now that I know what it is. And I was so fascinated by not only her skill set, but the way that she connected with the client. And she was just a great mentor and teacher by nature. So she would be like, do you want to learn more? And she called me over and she told me what she was doing, and I fell in love with it. I fell in love with her. She was everything I wanted to be, just her demeanor. And I loved how she connected with these patients. And I knew I wanted to do something in healthcare. I really thought it was physical therapy. But when I realized that the intricacies that the OT pulled out of the client, I loved that so much, that personal attention. So I knew very young in high school what I wanted to do, which is a real blessing because you don't waste any time. I knew I needed to go to OT school, and that was what started it.
So had that clear direction. So now looking back on 20 years, what would you say is your definition of OT? If you had
Oh,
to
that's
describe it.
You know, I tell my students when I do teaching that it's really hard to define OT, and I don't want this to be a cop-out answer, but it's so hard to describe a profession that does everything for every kind of person. It's hard to define it because we do all things for all people because we're client-centered and we're occupation-based, and every person does occupations. So, so it's hard to define what occupational therapy is because it's so vast and so amazing. And it's just really hard to define a profession like that. But I've come to just be okay with not being able to define it and allow people just to experience what I do in my work because you can try to describe it, but people don't know what it is until they've experienced it. And they're like, I just want more of whatever that just was that you can't put words to. But I really love that our lens that we look through, that we've learned through school and through just doing our professional development, helps us to look at the world in a different way. Um, and it just allows us to be able to see a person and what they want to do that's meaningful to them, and looking at every factor possible inside and out to allow them that opportunity to do so. Um, and that's what occupational therapy does. It looks at all of those contexts and all of those factors and all of those patterns, um, and makes that person do what's meaningful to them. And it's just a great profession to be a part of.
That's really interesting. I heard you use the word occupation, and I know a lot of people think, I don't want another job or I don't need a job.
Right.
So you want to describe a little bit about occupational therapy perspective on occupation?
Yeah, it's great that we have our practice framework that helps us kind of put this into a model of explanation. I think it helps us as practitioners to know the process of what we do, but it also then helps us to articulate what is occupation. And it's really all of the activities that make up your day, all of the activities that make up your roles that have value to your life. And I love thinking about the roles of people because when everybody identifies as a role of something, whether it's mother, therapist, spouse, sister, brother, teacher. You know, we have activities that make up those roles, and they're so valuable to us. And I think especially in a COVID world, we've realized that when we couldn't do those roles and fulfill those roles, there was something lacking. And so we all started to do OT on ourselves, right? Like, what do I need to do to manipulate my situation so that I can get back to doing that role that was so important to my life?
Mhm.
Even going grocery shopping, right? Preparing a meal for your family was inhibited by this pandemic. And I think it just really helped me to see the power that I have in being an occupational therapist, that I can do it on myself, right? And I can do it
Yeah.
on everybody around me. And that was such a great self-awareness, because all of a sudden I'm like, wow, I can do this on myself and make my life better because I know what I need to do to have meaning in my life.
I think in this time when it's so hard for people to have found that meaning, when work changed and family changed and all of those things,
Yeah.
that's definitely a very important contribution. And then if you add an illness or something to that,
Yeah.
um, occupational therapy has a unique perspective with that.
Yeah. And I really think looking at that performance pattern of roles is really a great shift. If you're looking for something to do different in your practice, think about somebody's roles and just focus on that for a little bit, just kind of bask in that and appreciate the role that that person needs you to help them get back to, because I think it'll change your service delivery a little bit. It's just a fascinating thing to go back to.
And to look at the roles that they value most or that they
Yes.
get the most value from themselves. Yeah.
Right.
So, Caroline, you and I met related to our shared interest in keeping people safe at home. And
Yeah.
you've done a lot of work in that area. Tell me and our audience a bit about what you have done and explored in that area.
Yeah, so one of the other areas that I love to work in when I do intervention is environment. Um, I have this coffee mug that says environment is everything, and I really believe that. Um, I just I really feel that that is the easiest um, area of OTs to be able to manipulate to enable function for someone. Because client factors, they can only get so much better with their head injury, or they're at a stopping point when they have a spinal cord injury, but the environment can always be manipulated to reduce disability for someone. And so I just became fascinated with environments and where people live and where they function, and knowing that I have this OT lens to be able to change environments so that people can participate. And the more I kind of tapped into that understanding that it's not disease that creates disability, but environments really, I became more passionate about speaking on this and helping OTs to understand you've got to look at the environment as well. And so I just started really getting into the idea of looking at environment, assessing environment, really trying to understand that person environment fit, and just became really obsessed with um, helping to spread the word on how important it is to work in that context as practitioners, because we really have a great way of looking at it. And so that's how I became just really excited about it, and have met so many great practitioners like yourself. But I see so many OTs that are wanting to work in this space now, because in their medical models of practice, like in settings, it's harder to experience the home environment, because they're in hospitals or they're in SNFs. And we know when you get someone in their home, oh my gosh, the the things
Things
that
just
come
change.
out are
Yeah,
awesome,
yeah,
awesome. Yeah,
yeah.
so it's hard not to fall in love with it. As you know, I mean, your whole career is based on this as well, and there's just the endless opportunities that you learn from
Mhm.
people's cultural aspects, from everything. It's just amazing.
It is, and I've been an OT for 40 years, so a little bit longer than you. And we did keep people a lot longer in hospitals and rehab centers, but we also were able to go out and engage in the environment and the community a lot more with them. And we're not seeing that now. And I think it misses that being able to really transition people fully back into those roles and into engagement in community and those valued occupations. And I think this is taking it one step closer towards that, definitely. But you not only had an interest in it and not only went to tell the people about that, but then you did a lot of work about developing tools. So tell us a little bit about that.
Yeah, one of the things that I found lacking was, OTs have this great skill set. You're in someone's house and you're seeing them do things, and there are like a million synapses firing in your head about, oh, look where they put their hand, or oh, look at how that tripped them up, or how that caregiver spoke to them and then they respond. Like there's so many things that are going on. And it's
Yes.
brilliant. It's brilliant what we see, and it's brilliant with what we come up with for a solution. The problem with our profession is we don't take that information and put it in a format that allows our distinct value to be shown. We're kind of driven by whatever system or paper we have in front of us that documents that, and it falls short of what we do. It falls short of all the wonderful things that happen, and it's not our fault. It's what we have to submit for billing, right? We can't help that we're working within our own environment that limits our own function, and that's really what's happening. So I wanted to develop a tool to the best that I could that would help replicate what happens when an OT sees somebody working in their own environment. What are the barriers and what can be the solutions? And I, thought that we needed to do that not only on paper, which is how a lot of our assessments are done currently, but I wanted it to be on a technology platform, so that we can get real data, real metrics, real solutions as the client's kind of working with the practitioner in that space. Um, and so I developed that technology to kind of help us really with the vision of moving our whole profession forward, by making it accessible in itself. And uh, it's been a lot of fun, challenging, right? Because you're trying to change habits of practitioners that have been doing things for a long time. And but I think the timing is good for where we're at right now.
Yeah, so this app is called Home for Life Design, right?
Mm-hmm.
And um, I think it made a big contribution. It's also something, when we do our training for home mod therapists, we talk about and discuss as well for a couple of reasons. Like you said, it's there with you while you're actually assessing. It shortens your documentation time frame, but it also gives you some scalable, measurable outcomes as well.
Mm-hmm.
But your contribution to the profession, to that, has just been recognized at our national association level. So I want to say congratulations because you just received a fellow. You want to
Yes,
tell
I
us a little
did.
bit about that?
Yeah, I was really pleasantly surprised. Of course, those are big milestones that you have. I never, when I became a practitioner, I never thought that I would be called to contribute things like this. But I think all of us are called to give back to our profession in some way, whether you mentor somebody or take on a fieldwork student or whatever you can do. We're all called to that level of professionalism. But when you see a real need on a population level and you recognize that you're good at it, right? Like it's important that you share that. And what's so great about our profession is they do recognize people that and encourage people to move in that direction for that reason. And I was fortunate enough to work, every OT like you, Sue, who I've reached out to say, hey, can you help me? I really want to do this and I don't know what to do. I've never met a practitioner that said, no, I don't have time for you. Never. Um, I have always been met with mentors who are willing to share information, um, walk with you, help you through that first home assessment. And it's nerve-wracking, right? Because you're like, am I doing this right? Um,
Yes.
and and our profession is so good about that. We're so good about helping our own. And so naturally, you just want to keep doing more because you get that, what I call a moho experience, right? You're getting feedback from your
Yes.
environment and it motivates you to do more.
Yes.
And then naturally, I was just, nicely recognized by some of my peers, and did receive my fellow. And it's been great. It's been great to be able to contribute so naturally. I say it's easy to do great things when you're surrounded by great colleagues like, you, Sue, and everybody that I've worked with has just been awesome, awesome to work with.
Yeah, it's been great working with you as well, and it's a great honor and recognition for the contribution that you've made with moving, particularly those environmental assessments for clients, being able to recognize how that impacts their ability to achieve and live their life well.
Yeah.
Um,
Yeah, I
yeah,
think so, especially I just for those of you who are AOTA members in the SIS quarterly that's coming out in May, um, I just wrote an article on how COVID should really help propel us to do more home assessments because people are going to want to be staying more at home and they need solutions. Family members are scared to put their loved ones in nursing homes now, and they're looking for someone to help navigate. What do I need to do? And so it turned out to be a really nice article, in terms of the contributions of other people that helped kind of look at this as an occupational justice issue, that we really need to get out there and help this group of elderly who are at most risk for COVID. How do we get them to stay in their homes, but not just live in their homes, but function, removing the barriers, being a solution. So I think that's a really good article to read if you want to kind of get inspired and look at where we're at as a world, where we're at as a practice, and what we can do to help.
yeah, and along that lines, I'm seeing more of that, but I'm also seeing these aging parents who are caring for adult children with disabilities, who are now
Yes.
facing the same challenge they may have normally prior before considered them going into a group home or another living alternative. And now they're saying, I don't want to be where I can't visit them. I don't want to be where
Right.
we're in this situation again. And so, seeing a lot of those and helping them be able to take care of this adult child who needs assistance as they're aging themselves. So there's that challenge definitely,
Yeah,
that's
I think
happening.
so
Yeah.
too. To kind of go along with that, I think I found that, now that these kids, especially those with intellectual disabilities or autism, are kind of aging out of the educational piece, the parents, I think, were hoping that their students would have a lot of these transitional skills through the school systems, and they're realizing there's a gap there, right? They didn't learn everything that they need to do. They can't go live in a group home. They didn't. So in other words, all those years of education through, in their early 20s, all of a sudden they're like, well, now what do we do? And there's a real gap there. So I agree with you. There's a lot of opportunity in that area as well.
Yeah, and a lot that we can contribute to the quality of life and
Yes.
the easing the level of stress and concerns for the caregivers and families in that area. Where do you see occupational therapists, home modification, environmental modification, when you look into the future, your crystal ball, which every one of us doesn't have that functions very well, because
Yes,
COVID showed us that, right?
sure did. Sure did.
Where are you seeing the profession taking this? What are you seeing happening?
Well, the good news is that, people like yourself and other people in this area of practice have paved many roads to show OT's distinct value, so much more that we're starting to see federal funding that identify OTs as needing to be part of in order to receive this federal funding for aging in place, you have to have an OT. That was not easy to do, and that it was collectively done by many of us individuals dividing and conquering, knocking on doors. Um, I mean, but there was a lot of blood, sweat, and tears in that. And I think we're starting to see the benefit of it. What I hope is that we as a profession are ready to receive what we ask for. Be careful what you ask for. You might just get it, because there is way more elderly people that need our services than there are practitioners. And it could end up being something that we can't handle, and I think it's really important that the demand, we try to meet the demand as best as we can, that we do best practice. We don't settle for, measures that don't show our distinct value. If we do happen to be a part of these programs and they're using assessments that may not show what we can really do, we need to advocate for that to be shown. And so that we can prove that we're effective, and that they don't say, well, anybody can do this. Why are we paying you the OT when we could have a physical therapist do it, or a nurse even, to meet that demand? So I think we need to be careful with that.
Yeah, interestingly, there's already some emerging research that says that a trained technician still doesn't, while they make changes, it's still not as good as if an OT does it, that there's some unique sauce, some unique
Yes.
piece of OT
Yes.
in there. And nothing against our sister profession, that we need to work as a team, but even a
Mhm.
physical therapist, their approach is not the same. And the CDC just recognized that in their guidelines as well for fall prevention,
Yeah.
that the home safety assessment by an occupational therapist is the key component of that.
So I think the future is good for us. Um, I just know that in past opportunities where we've kind of been the go-to resource, we always haven't been able to meet the demand or bring along with us measures that show and prove this demand, so much so that they never let anybody else in.
Hmm.
And so I think any OT practitioner that's going to partake in these great opportunities to reach out to those of us who have been doing this for a while, get mentored, learn what best practice is, do your due diligence in making sure that you're representing the profession in the best way possible, and advocating for that as well.
Yeah, I think that's really, really key and important. Um, any last words for the profession or people wanting to use the services of OT?
No, I'm just so grateful for, people like you that use these platforms to help get the word out and talk to other OTs. I think it's great that you're just so innovative, Sue, with helping people to learn and keeping us together, as a unique group with a unique skill set. It's important that we help each other out, and I really commend um, your willingness and devotion to doing this, because it's out of love, right? It's not out of all the money you make from doing these kinds of things, and I think that needs to be recognized. And I'm grateful for you for that, and I'm always willing to talk to people and to share our experiences.
Great. Well, thank you. And again, congratulations on your well-deserved honor for the
Thank you.
fellow and for the contribution of moving our profession to really address those environmental concerns in a standardized way, and also in a way that reflects our unique thinking behind
Yeah,
that,
yeah,
but in that we can measure. So that's
awesome.
great. All right. Thank you. Happy OT month.
Yes, thank you. Happy OT month.